All right, we are live. We'll go ahead and give it a couple seconds here to let some folks join us on the page, and then we will get started here shortly. All right. So we can go ahead and get started here. Hi, my name is Chelsea. Welcome to our COVID-19 vaccine Facebook Live with updates for the state of Wisconsin. Here at Network Health, it's really important for us to be able to share the latest on vaccine updates in the state. And we have with us Andy Wheaton, who is our manager of pharmacy benefits, and he is our expert here for the COVID-19 vaccines in Wisconsin.
Thanks, Chelsea. Yeah, so I'm a pharmacist by trade and manager of the pharmacy department at Network Health. This past fall, I co-led our Medicare flu vaccine events for our Medicare members, making them COVID friendly, and now working to provide the most up-to-date information to our membership on the COVID-19 vaccines. So happy to be here and share some of the information.
Thank you, Andy. We are so happy to have you here as our expert. So we can kind of jump right into, well, before I jump into questions, sorry, getting a little ahead of myself. If anyone on the stream here has any questions or comments at all, please go ahead and drop them in the comment section below, and we will answer as many questions as possible along the way. We also do have Kelly, who will be in the chat, and she can share any relevant phone numbers or links or help you out along the way as we are going through the live here. So we'll jump right into the questions. Andy, we had a new phase of eligibility that began this week. Can you tell us a little bit more about this?
Yeah, very exciting. So up until this past Sunday, those with comorbid conditions were eligible. And then starting this past Monday, so April 5th, is when all individuals age 16 years of age and older are eligible for the COVID-19 vaccinations in the state of Wisconsin. So very exciting information, very exciting update to the eligibility population for the state of Wisconsin. This is going to increase and improve the vaccination rate in our state and hopefully get us even closer to that herd immunity that we talk about, so that we can start to open up a little bit more and get to some more normalcy, as we'll say.
Fantastic. Yes, such an exciting update. So naturally, the next question is, where and how can I get a vaccine?
Sure. Yeah, so I really encourage people to go to our Network Health website and click on our interactive map. This is linked to the Department of Health Services through the state. This is updated on a regular basis. I think it's updated weekly, and it indicates which vaccination locations have vaccine supply. So you can click on the actual location where whatever's nearest to you, and then you can select either a pharmacy or some different clinic setting where they'll provide the vaccine, and they'll provide that sign-up information. Over the weekend, I started to get several family members and friends started texting me, calling me, where can I get the vaccine, right? Most vaccination locations will open up their scheduling. From what I saw over the weekend, there were quite a few openings over the weekend. So I encourage you, if you see that there's no openings at this particular time, keep checking back. They're going to update their websites on a regular basis as they see supply coming to them. So keep checking back. I would encourage you specifically to look on Saturdays and Sundays, because it seems like that's when they open up those time slots for the upcoming week.
Okay, great. That's great news. And then, yeah, just keep checking back throughout the week to check for any cancellations or updates in that scheduling as well. That's a great tip. Thank you. So as far as effectiveness, do we know how long the vaccine really lasts and how long you're good once you get the vaccine?
Yeah, so I think the data is still coming in on this, and this is something that everybody's looking at. So whether it's the Pfizer, the Moderna crew, or the Johnson & Johnson teams, scientists are looking at this on a regular basis because they're looking at it. Are we going to have to revaccinate in a year, or what does that look like? So we recently heard from Pfizer that they provided data demonstrating COVID-19 vaccine remains highly effective up to 6 months after the second dose. Now, that doesn't mean that it's only 6 months. It just means that's where the data is at this point. I would assume that I would expect that to be even longer. I would say, we can expect that much longer than 6 months, but at this point, that's the data we have. They're going to continue to monitor a certain population of volunteers up to 2 years after that second dose to kind of determine the long-term effectiveness of the vaccine. And like I said, Moderna, the Johnson & Johnson teams are also looking at this. This is a hot topic that they want to understand, the longevity of the vaccine and what revaccinating and booster shots are going to look like in the future.
Absolutely. Good to know, and we'll keep an eye on that and kind of continue to share updates as we hear more as well. So another thing that we've seen in the news that I would love for you to kind of touch on and explain a little bit more is a rise in cases and a worry of another wave coming in. Can you kind of explain a little bit about what we're seeing there and kind of what we're hearing in the news around that?
Yeah, so we're seeing that a little bit in the state of Wisconsin, a little bit of an uptick on COVID positive cases. This is going to continue to be a concern as nicer weather is upon us in Wisconsin. We're all looking to get out and start to enjoy some of that nice spring weather and also get together with some family and friends. Throughout the country, there's a concern of another wave, along with in the state of Wisconsin, of COVID-19 infections, with people being a little bit more relaxed with their precautions. This is one of the main reasons the states are opening up their vaccination eligibility to everyone 16 and older a little bit sooner than you would probably expect. We want to get those vaccines in patients' arms so that we can minimize the kind of the spread of COVID. My word of advice, and I'll continue to push this, is please continue to take those COVID-19 precautions that we've been working on so diligently over the past year. Masking, make sure we're socially distancing, and hand washing. In the event that you are fully vaccinated, the CDC has updated their guidance. So just kind of keep that in mind. And fully vaccinated is 14 days after you received your last dose. So the CDC has removed some of the restrictions on people that are fully vaccinated. So you can start to hang out with people that have also received the vaccine in limited situations. I believe Kelly has one of the links, the CDC links, that she can share in the chat box, highlighting some of those removal of the restrictions as far as the CDC is concerned.
Fantastic. That's good to know. And yeah, keep paying attention to the CDC as these updates come. Which kind of leads us to our next question that we have here is, what about the mask mandate? So we heard that the mask mandate for the state of Wisconsin is no longer in effect. Can you tell us a little bit more about that and what folks should aim to be doing still?
Yeah, so on March 31st, the Wisconsin Supreme Court struck down the statewide mask mandate that was issued by Governor Evers. Although the state doesn't have a mask mandate at this particular time, most local ordinances or counties implemented their own mask mandate to replace the state order. So I still recommend wearing the mask, and this is in line with the CDC guidelines and recommendations. My word, just encouragement here is, remember, not wearing a mask not only helps you, but those around you, especially if you have a family that's at a higher risk for infection. So not only wear it for yourself, but wear it for those in your community members around you. So.
Absolutely. Thank you. Another question we have here, so kind of getting a little bit back to vaccine questions. We've heard a lot about side effects of the vaccine and questions around, am I going to get COVID from this vaccine? Should I take a day off of work the day after I get my vaccine? Can you kind of give us a little bit of information about the side effects and what people are experiencing and just kind of questions around that?
Yeah. So I want to assure everybody you're not going to get COVID if you get the vaccine. There's no active COVID virus in the vaccines. You're basically getting either a piece of protein that's going to allow you to recognize the COVID virus within your body a little bit easier, but it's not going to cause the virus itself. So I just want to make sure everybody's assured there. From a side effect standpoint, it's going to vary from one person to the next. And I hate to call it side effects because some of these reactions are somewhat expected. So if you get a vaccine, your arm's going to hurt because we just gave you a vaccine. So
Yeah.
to be expected. So I received mine a little over a month ago. My first one, my arm hurt for a day or two. That was to be expected. My second dose, I received that about 2 weeks ago, and the only additional side effect, if we want to call it that, was a little bit of chills. Nothing severe. I just wanted to wear a sweatshirt for the day. But everybody's a little bit different, so everybody's going to have maybe a little bit different reaction, and that's what you hear as you talk with family and friends that have received their vaccines. Other common side effects are going to be headache, fatigue, and muscle aches. Although these are mildly uncomfortable, they generally go away within 24 to 48 hours after you receive that dose. And it's an indication that your body's mounting a reaction to the actual vaccine, which is a good thing, and it's really expected. So no concerns there, but just wanted to let everybody know there are some of these types of things coming out after you get the vaccine. Just be mindful of them. And I don't think it's something that you need to take a day off of work for. Some companies are a little bit different. They're offering days off depending upon the employer. If that's great, if you have that opportunity, that's great. But I wouldn't proactively do it if needed.
Fantastic. Good to know. Thank you. So another question that we received ahead of time is, I never get the flu shot and I'm fine. Like, why do I need to get the COVID vaccine if I don't ever get the flu shot and I'm totally fine?
Yeah, so I encourage everyone to get the COVID-19 vaccines when available and eligible. The effectiveness of the COVID-19 vaccines is much higher than the traditional flu vaccine. So that's one of the kind of differences between the two. Now, don't get me wrong, I still recommend getting the flu shots as well, and I'm very passionate about that. But the COVID-19 vaccines are very highly recommended. We also need to look at the severity of the disease. So the risk of severe disease, hospitalization, and potentially death with coronavirus is much higher than your traditional flu virus. So that's probably the biggest driving factor of getting that COVID-19 vaccine compared to the flu.
Awesome. Good to know. Good to know. That's really important. And then I think kind of related to this, I think some of us have family members, loved ones, friends who are not convinced about getting the vaccine. So how can we talk to people in our lives who are either unsure of or against the vaccine or just don't really plan on getting it? Do you have any tips for those of us who know people like that in our lives and how we can kind of talk about that and help to get them on board with the vaccine?
Yeah, I think kind of going back to what I was just talking about. So we want to make sure that they understand the severity of the disease. So if you do get COVID, there is a chance that you could have a little bit more severe disease compared to, say, your traditional flu or any other virus. So the chance of hospitalization and even death is much higher with COVID. So that's a little bit more of a reason to get it. From a talking standpoint and talking point standpoint, I would really focus on discounting any myths. There's a lot of myths out there. Am I going to get COVID with the shot, or is there any tracking device within the shot? There is none. Just want to make sure everybody's aware of that. So be assured there. So make sure that we discount any of those myths and get the facts up front and center. So there's so much misinformation going on with internet posts and things like that. We just want to make sure everybody has the facts so that they can make an informed decision on getting the vaccine.
Fantastic. Thank you so much. That's very helpful. And, if we have folks who need a little bit more help or want to reach out to us and have questions on how they can talk to their loved ones, definitely message us or reach out to us here on Facebook, and we can provide you with some talking points and some resources as well. One final question that I have here is, when will children under 16 be able to get the vaccine? So right now, eligibility is for everyone in the state of Wisconsin above 16. But do we have any more updates or information around under 16 and kind of when that age group might start getting vaccines?
Yeah, so we heard from the Pfizer and the Moderna teams. They're starting to do their clinical trials with those that are 12 to under 16, so ages 12 to under 16. They expect to have those results within the very near future. I would say, maybe towards the middle of May to end of May. Their goal is to get approval for the vaccine for those 12 and older by the time school is in session in the fall. So that's kind of the goal or the thought that they want to, or goal that they want to reach for this next year. For those that are under 12, the data is still being collected. They're just starting the clinical trials on those that are under 12. I wouldn't expect anything probably this year. That's going to be probably early next year before we start to see some of that information coming out and that approval from an FDA standpoint.
Gotcha. Good to know. And I think that's great news for parents and teachers out there with kids from 12 to 16 for sure. Yeah. And I think that's all the questions that we had ahead of time. I'm not seeing any questions in the chat, but we'll give it a second here if anyone's got some questions. If they want to follow up with us, again, feel free to reach out to us on Facebook. We're accessible. I'm here to help connect you with whoever we can to get you those questions if you have more. And we will absolutely be back here next week with another Facebook Live with any other updates that we have. So we'll give it a second here, but I don't know that we'll have any questions. So fabulous. So I think we'll go ahead and wrap up here. Andy, thank you so much for taking the time to meet with us and give us these updates and answer questions. And we will be back here next week with any further COVID-19 vaccine updates for Wisconsin.
Thanks, Chelsea.
Thank you. Bye-bye.